Let's go first to Nantucket, Massachusetts. Good morning, Robin. You're on the air.
Yes, I have I felt like you were talking to me. I have a son who has had 2 open heart surgeries and is now doing wonderfully. And
Congratulations.
I have my own, thank you, I have my own business.
It was you. I was describing you.
You were. I have a family of 3. We are 3. My husband, myself, and my son. And we have Blue Cross Blue Shield at the cost of $1,600 a month with a $5,000 deductible.
Wow.
I know. And I did go to healthcare.gov to, be a good consumer to see what I could do. And there were much alternatives. I can get a lower monthly and a higher deductible, but it's like back to where I started. And I'm all for the health care reform. It's very bad, but it really didn't do anything for me.
And here she is in Massachusetts, where Governor Mitt Romney did put health care reform, his own brand, into place. What alternatives does she have, if any?
Well, I would say at this point, unfortunately, there aren't a lot of new alternatives available. I think the provisions for her son have changed so that companies now can't eliminate her son from an insurance pool. And what we're going to see is rates, according to the Congressional Budget Office, which come down over time as we bring others and, frankly, more healthy people into insurance pools. That helps to share the risk. Because right now, as a taxpayer, the family from Nantucket is also paying for everyone who doesn't have insurance, who's coming through emergency room doors or who is accessing the health system often in a very expensive way. I would say that there are also going to be additional insurance options for small business owners once we get, again, to 2014. Even in Massachusetts, they're looking at ways to further expand their exchange system. And I know, Diane, one of the things that Governor Patrick in Massachusetts has talked about is that the Massachusetts effort tried to address access first, bringing everybody into the insurance market. And that was the Reform Act that Governor Romney signed into law. He has spent a lot of time and energy looking at cost as step 2, because that wasn't a part of the overall conversation. And he recognizes that some of that can be done in Massachusetts. A lot of it has to be done nationally. So the work that we are underway right now in terms of addressing the rising costs, the underlying costs, will actually help the family as significantly as anything that's happened in Massachusetts.